Afternoon. Just want to welcome everybody who's been able to join us so far. Looks like we have a packed Zoom room as far as rooms go these days, right? Virtual rooms, that is. But good afternoon. My name is David Azevedo. I'm an Associate State Director with AARP California, and I'm joined by my co-host and partner in crime today, Flora House, who is an AARP volunteer and executive council member with AARP California. We'll go ahead and get started here. We have a tight hour and lots to get to. So as a gentle reminder, please keep yourselves on mute today. We're going to be having about 40 minutes of conversation with our panel experts, and then we'll have 15 to 20 minutes for Q&A with our participants here. If you have any questions, just make sure to drop that in the chat. So good afternoon again. Thanks for joining AARP's second Climate Chats virtual event. Thank you so much for joining us today for a critical conversation on how extreme heat is affecting you and your health. As a reminder, also too, this meeting is being recorded, which I think that you may have seen in the little notice that popped up. So with that, again, my name is David Azevedo. I'm an Associate State Director and staff with AARP's California State Office. Our team works hard to deliver results for our 3.3 million members in the Golden State, working on important quality of life issues in healthcare, retirement security, and age-friendly communities. The Centers for Disease Control and Prevention defines extreme heat as, quote, temperatures that are substantially hotter and or more humid than average for that location at that time of year. According to the Environmental Protection Agency, heat is the #1 weather-related cause of death in the United States, killing on average over 600 people, mostly older adults, each year. This average, however, is being challenged by climate change. During the record-breaking heat wave in California, Oregon, and Seattle this past June, more than 500 people were killed in the span of only 4 days. Again, most of these individuals were older and lived alone. The rest of summer 2021 continued to set severe heat records. The period of time between June and August is now the hottest on record. According to a report released in August by 195 world governments, we are effectively locked in to the number of extreme heat events we saw this past summer, and these events will continue to get worse over the next decade. AARP has a 60-year history of standing up for generations of older adults and their quality of life. Extreme heat is a clear and present danger to that quality of life for older adults now and in the future. And that's why we're here today to talk about how we got to this point, where we're headed if we don't take action, and what each of us can do as individuals and together in our communities to prepare for worsening extreme heat events and learn how it affects our health and well-being as we age. So we'll go ahead and get started. Really quickly, wanted to introduce my co-host for today, our Executive Council President for AARP California, Flora House. Flora, do you want to say a couple words?
Yes, thank you, David. I'm very honored to be here today, and I'm honored to be a member of the California AARP Executive Council. As a registered nurse with over 50 years of experience, and most of them in emergency services, the issues that we're going to be discussing today come very close to my heart. And so I hope that we're able to educate you, entertain you, and increase your awareness on the issues that we're going to discuss and spark other questions that you'll have in your homes and your communities. Thank you for joining us.
Thanks so much, Flora. So another brief description for those, we had a couple other people join us in the last couple of minutes. So this is our AARP Climate Chats on Extreme Heat. Thanks so much for joining us today. We're going to spend the next half hour to 40 minutes in an in-depth panel discussion with our experts, which I'll introduce in just a few minutes. And then we'll open it up to audience Q&A. Please keep yourself on mute for the duration of the next 30 to 40 minutes. If you have a question, we're more than happy to take it. Please just go ahead and pop that into the chat. onto the side there and make sure that you click that little box that says "to everyone." So we'll introduce our great panelists today. Our first panelist here is Dr. David Eisenmann, MD. He's a professor at the David Geffen School of Medicine at UCLA and has a joint appointment at the UCLA Fielding School of Public Health, where he directs the Center for Public Health and Disasters and is the Deputy Director for Community Partnerships at the UCLA Center for Healthy Climate Solutions. Dr. Eisenmann is also an associate natural scientist at RAND. Dr. Eisenmann lives and surfs in Marina del Rey, California. Love surfing in MDR. Our next panelist is Enrique Huerta with Climate Resolve. He's the legislative director there, and Climate Resolve is a nonprofit organization based in Los Angeles who likes to make a lot of friends so that we can nudge governments to make lives, communities, and the environment better. Enrique is responsible for connecting communities, organizations, and policymakers to address the global problem of climate change with local solutions. Enrique attended Cal Poly Pomona and received degrees in urban and regional planning and regenerative studies. He lives in Downey, California with his wife of 16 years, 2 kids, and his pet dog, Pepper. So we're going to go ahead and spotlight our 2 great panelists here. If you'll bear with me to get them on the screen so that we're all together here. Good to see everyone. Everyone's looking good. So we'll go ahead and start it off. I'll ask the first question here. Flora and I are going to go back and forth here. But the first question is to Enrique with Climate Resolve. So what is it about extreme heat that has caught California's attention? And what is the science telling us?
Thank you, David, for that question. Good afternoon to everyone, AARP community. It's an absolute pleasure to be here to talk about something very near and dear to me, extreme heat. And I got to tell you, David, if it wasn't for organizations like Climate Resolve and a lot of our other partners throughout the state, including AARP, I don't know that California's attention would have been piqued the way we did. As you know, for the past year, my legislative team and I have been forming strategic partnerships up and down California. And we've been speaking with a variety of legislators and their staff on behalf of a bill that Climate Resolve sponsored, AB 585, the Extreme Heat and Community Resilience Program. And one of the issues that really caught our attention as an organization was that 16 of the last 17 years have been the warmest ever recorded by human observations. And this is a record that goes back 1,700 years. And things, according to our climatologists, are only going to get worse. Heat waves are going to become more severe and more ferocious. And so we've been absolutely amazed that in these past 16 or 17 years, California has done zilch about extreme heat. So that was very surprising to us. Something else that was surprising was the genesis of our bill. A couple of years ago, during an extreme heat wave, our executive director, Jonathan Parfrey, paid a visit to a local cooling center in the city of LA. And much to his surprise, it was completely empty. Not one soul was taking advantage of this really beneficial resource. And so we got to thinking, why is that? Can we make cooling centers better? Maybe turn them into a place where it's a one-stop resource for a variety of services, from medical to backup power services, just a variety of services. And we started coining this term, resilient centers. And so through our bill, AB 585, we also fought for resilient centers. And here's why. We know that older adults, young children, outdoor workers, athletes, and people with a chronic medical condition, among others, are especially sensitive to negative health impacts from extreme heat. In fact, the #1 group most affected by extreme heat illness and death are our older Americans. The number of extreme heat days in LA County is expected to rise in the coming decades due to climate change. Also, extreme heat waves are set to occur every decade rather than once a century and will claim more lives, especially the ill and the elderly. Here's the problem. Our cities, because they're so car-centric, it's like we designed them to become heat-absorbent places. And that creates a very, very bad phenomenon that we like to call the urban heat island effect. And what the urban heat island effect is, urban temperatures are a lot harder than they are in our rural areas where there's not enough, where there's not as much pavement and buildings to absorb this heat. So extreme heat is climate change's most life-threatening impact. California is experiencing the effects of climate change now through the increase in frequency and severity of extreme heat events. And like I said, things are not getting any better, and we need to adapt to those circumstances because we know that globally temperatures are going up. And even if we were to stop producing greenhouse gases, which are the #1 driver of extreme climate change, we still have to live with these conditions for many, many decades. So our goal here at Climate Resolve is to adapt our communities now to these growing extreme heat events.
Thank you so much, Enrique. And I know, so we're going to turn it over to Flora just in a minute to talk with Dr. Eisenmann about the health impacts. But really quickly, there was a couple terms that, for those who may not be familiar, that you mentioned. So greenhouse gas emissions. Could you just say just a little bit about that and just a very quick reason why you're bringing that up in the context of extreme heat?
Yeah, so in the context of extreme heat and climate change, globally, there are some natural occurring gases that are naturally emitted. And over many, many eras, these have led to some changes in our atmosphere. Some have been more dramatic than others. But what we're finding in the last, 200 years or so, since the Industrial Revolution, is that human-caused emissions of what are called greenhouse gases, and there's a long list of those, but carbon dioxide in particular, have increased significantly to the point where a lot of our global temperature increases have occurred within the past 4 decades. So since 1901, we've had an increase of 1.8 degrees Celsius. However, 1.2 of that total have occurred from like 1985 to 2021. And so that is super significant to us. It's telling us that there's way too much carbon dioxide in our atmosphere, and it's accelerating climate change and extreme heat.
Thanks, Enrique. I think that's a good enough summary, and just really excited to turn over to Flora here to talk to Dr. Eisenmann about those individual impacts of extreme heat to the body's health. So take it away, Flora.
Thank you, David. Enrique, by the way, before I target my question to Dr. David Eisenmann, I love the conversion from cooling center to resilience center. It has a much more impactful and directive feeling about it. So kudos. I think something as simple as that makes tremendous sense. Anyways, Dr. David, so we've talked about the science and the big picture. But what about the impact of extreme heat on an individual's health? What physiologic changes, in other words, what changes to the human body, especially to older adults, occur during an extreme heat event? Are there acute and chronic problems? I think that's enough. I have more pieces to it, but I don't want to overwhelm anybody. Thank you.
Yeah, listen, it's a privilege and an honor to be here. Thank you, AARP, for hosting this and inviting me. Yes, so Flora, our body's temperature is pretty well set at 98.5. We know that to be in Fahrenheit, our normal temperature. And if it goes up by or down by a degree or so, we feel sick. We're pretty exquisitely set at that temperature. Now, to avoid getting too hot during a hot day, an extremely hot day, our body gets rid of heat that is being accumulated in the body. It gets rid of it in two different ways. The first way is that we sweat, and the water that comes out on our skin evaporates, and evaporation cools off our skin, and it feels cooler that way. The other way is that our blood vessels that normally go to the skin dilate, they get bigger, bringing more blood to the skin, and blood carries heat. Blood is warm. So if you bring more blood from the internal organs to the skin, it can then radiate away, and you can cool the body that way. Well, the problem, I mean, those two mechanisms work fine, except they get a little impaired as we get older, naturally. Just to back up there, when the blood is going from the internal organs to the skin, less blood is going to the internal organs. And so just remember that, because we're going to circle back to that in a second. So what happens as we get older? There are certain physiological changes that happen to all adults. First of all, we produce less sweat. It's just a natural function of aging. We also have less thirst compared to younger adults. And I say we, because I'm an AARP member also. We have less thirst compared to younger adults, naturally. We also start to take medicines, and some medicines can dehydrate us, or they can impair our sweat even more, or even a few of them can dull slightly our sensation of thirst. And the last factor that occurs, of course, is that as we get older, we develop more chronic medical conditions. And a lot of those make it more difficult for the stress of heat for our body to adapt to it. It makes the stress of heating more dangerous. So if, as I told you, your blood vessels are dilating and blood is going off from the internal organs to the periphery, well, if you already have a little bit of chronic renal disease, that's less blood going to your kidneys. Your kidneys now see less blood, they get more damaged. Also, one of the things that happens as it gets hot is our heart starts to race a little more. But if you have a little weak heart, that's not good for you. Your heart can't handle that. So a feedback loop also happens. As we get hotter, we also get weaker and more tired. So I already told you that our thirst is impaired. Well, now we're getting a little more weak, we're getting a little more tired, and we don't get up, we don't get a drink. So we get further dehydrated, and this kind of feedback loop happens. And the signs can be very subtle, especially as we get older, and especially if you're not living with somebody who knows you very well, they can get pretty well unnoticed. So that's why the risk is certainly higher in older adults, but it's particularly higher in older adults who live alone for this reason. It's also worth pointing out there are other factors, and I know we'll get to this, but this is also confounded or made worse in low-income communities, and I'm sure we'll talk about that. And it's worth talking about the phenomenon of winter heat waves in Los Angeles, which very few people recognize, but I'd love to take a question about that later on. So I'm going to end there because I've already talked too long.
Thank you. You certainly give meaning to the phrase that getting older is not for the faint of heart. And I do want to acknowledge that your comment about the fact that no one to observe the changes because you're alone has certainly been exacerbated over the last year and a half with the other issues that we face in terms of the COVID. And I do want to add one little final postscript question, and that is, how does extreme heat affect a community's health? You've been very clear about the individual, but we as individuals collectively become our own community. And I wonder if you could speak to that.
Yeah, it's interesting. When we have a community, it actually is very protective. So for instance, we've seen some signs in our research that older adults who lived in senior villages where you have to be 55 and older, for instance, to be a member, that as it got hotter, while other communities were having increasing rates of medical problems, those communities showed a little bit of a protective effect. And, if you go visit some of these communities like I have, they'll tell you, people are very aware of heat, and they tell each other, Flora, it's getting really hot out today. Stay inside, make sure to drink, and they look out for each other. And it's that looking out for each other that it's a protective effect. So I think we really need to be thinking about that kind of whatever we can do in social cohesion. If it's really hot, it keeps us away from each other, right? We are, like I said, we're weaker, we're more tired. We retreat into our homes or to wherever we think there might be some shade. And that just increases our isolation. The cumulative effect is much greater in communities that are low income. These are communities where, there's still a high percentage of homes without air conditioning or with inadequate air conditioning mechanisms, or people who don't have the income to even pay for air conditioning, they have an air conditioner, but they don't want to run it because of the electricity bill. And so that's where it really comes to be a problem, is when you can't cool down at night because you can't afford the air conditioning.
Hence the resilience centers that Enrique talked about. David, back to you.
Yeah, no, thank you so much for that. I learned a couple of things there that I had not even thought about, especially about the losing your thirst as you get older. Flora, I love that comment about not for the faint of heart, although I know quite a number of very heartful older adults in my life that run rings around me. But no, so thank you so much for that, Dr. Eisenmann, for really getting us that physiological and what that means for our bodies in terms of heat waves. So this next question is for both of our panelists. Enrique, your organization, Climate Resolve, you were telling me a little earlier that Climate Resolve wanted to learn more about how community level data from heat-related illnesses are informing public health officials and helping those officials develop better heat resiliency policies and programs. So could you tell us first, Enrique, a little bit more about this research? And then can you and Dr. Eisenmann talk about each of your own very different experiences on this issue, regarding this? And Flora, you also may want to chime in too with your experience in healthcare.
Yeah, thank you for that question, David. I'd love to talk about this. So Climate Resolve, along with other partners, we have been paying attention to various community cooling strategies that studies have shown benefit communities greatly in reducing ambient temperatures. You've mentioned the critical need for air conditioning in individuals' homes. We recognize that too, but we feel like that puts too much of the burden on the individual resident to take care of themselves. And so we'd like government to coordinate with many, many other agencies throughout the state and start establishing community cooling strategies like what I mentioned. Resilient centers would be one, but also increasing the amount of shade on our streets is a proven technique to reduce ambient temperatures. Even better, combine more tree shade with reflective pavement. And you see not only many co-benefits to that, more people walking the streets, more eyes on the streets as a deterrent to crime, for example, but studies have shown that up to an 11-degree reduction in ambient temperatures when you do those kinds of integrated strategies to reduce ambient temperatures. So we feel that those kinds of solutions are there. The research has been done. There have been several pilot projects that have been done, including one that Climate Resolve was directly involved with in Canoga Park here in the city of Los Angeles, whereby we have resident testimony who have said, before you guys installed cool paving, which is basically adding a coat of white paint to pavement. They said prior to this, cool pavement strategy, I could never come out and walk my dog. And now I'm able to, walk my dog throughout the day. And we have pictures of them doing this. So the projects are out there, the strategies are out there, but what's missing is government involvement. And we feel like government could really, really go a long way to, for example, create maps that identify where some of the hottest places in cities and throughout California are. We've done that, but we feel like government should be doing that as well. But the problem there is that those kinds of initiatives require a lot of government coordination. And in our research, we've identified up to 12 government agencies that all interact with extreme heat, and they're all working in silos. They're not talking to each other, nor are they coordinating any of these ambitious strategies that I just talked about. So that's something that we tried to clean up with our bill, AB 585, and that's something that we're still pursuing to this day.
That's really helpful, Enrique. And I know too that there was a component of that research that kind of looked at some possible gaps between public health officials and the medical community, say hospitals or doctors. Could you talk a little bit about those gaps? And then we could bring in Dr. Eisenmann to maybe give his kind of scene, because it seems like Dr. Eisenmann, right, you're really there at the first response and also practitioner level. And Enrique, you're kind of coming from that angle of the community-wide and public health and statewide kind of perspective. So Enrique, could you just share a little bit more about the gaps that you're concerned about, and then sort of kind of dialogue, I guess, with Dr. Eisenmann and what he's seeing on his side?
Absolutely, and thank you for bringing that up, because you're absolutely right. One of the critical areas that we uncovered in our due diligence research is that heat-related illnesses are not a reportable condition at the state or federal level, unlike more ubiquitous things like foodborne illness or lead poisoning or measles, for example. The state actually has a really sophisticated and comprehensive portal for practitioners to actually enter a lot of this data. And in doing a review of the various codes that are listed, I couldn't find one for extreme heat illness, and that was very concerning to us. It really validated a lot of what our public health partners were saying at the state level, which is something that they needed. They also mentioned that a lot of the practitioners on the ground, Dr. Eisenmann and Flora excluded, they weren't entering a lot of these codes on their own. And so there needs to be a push at the local level to really bring local practitioners up to date and remind them that this is a really important issue that we need more data on. And I think a lot of that goes back to how extreme heat for years has been a silent killer. It's been very quiet and not on the radar for a lot of our public health practitioners at the state level. And so we were really hoping to change that with this bill, AB 585. But yeah, just a couple of more things that we discovered. When patients seek care due to less obvious effects of chronic heat exposure, doctors may not assign them one of the few health illness medical codes that can help researchers track the extent of the problem. And this was really brought home in a 10-day California heat wave in 2006, where over 650 people died due to heat-related conditions. 70% of those deaths were elderly Americans. And then finally, across California, heat-related emergency room visits increased by 35% between 2005 and 2015, with a disproportionate increase among African Americans, Asian Americans, and Latinx residents due to the inequitable impacts of extreme heat.
You know, before you chime in, Enrique, your point is exceptionally well taken. And I will tell you that it becomes so important to have those other demographic measures of individuals who are suffering the secondary effects of that chronic heat, because without having that, then our resources cannot be focused on the communities that have these individuals and most need the resources. So getting that ICD-10 coding up to snuff, another headache for the physicians to do, but certainly if we don't measure it, then we're not going to be able to have the impact in a positive way of what's happened. So Dr. Eisenmann, I'll turn it back over to you.
Yeah, well, I don't want to repeat anything Enrique said. I want to emphasize what he said and take it the next step further. This absence of data is a real issue. We should, at this point, have the systems available so that as heat-related illnesses are coming into emergency rooms, that data is being captured in real time and made available to researchers and organizations that are involved in the response, so that we can know, for instance, we could then map which zip codes and which streets are people coming from and start to send out some resources there. You know, if there's one set of blocks in a neighborhood where we're seeing, you know, 1 or 2 calls for an ambulance, or someone comes to the ER, by the way, there's both ambulance data as well as emergency room visit data that I'm talking about here. Well, could you send out volunteers to go knocking on doors to make sure everyone's okay? You know, kind of activate neighborhood associations. So all this data is being generated, but darned if you want to get hold of it. When I try to get hold of this data for my research, it takes me a year to get data, and it's already, and I can't even get the most recent data. I can only go back 1 year to 2020 right now. I can't even get most recent data. So, you know, we're lucky in public health in Los Angeles because our Los Angeles County Department of Public Health is very big, and they could probably, if they had the real-time data, do something with it. But there are a lot of smaller public health departments around the state which could really use partnerships with researchers and universities. And if we could just get hold of that data in real time, we could work with our public health departments and work with our emergency managers and work with our community-based organizations and our senior centers and so on, and really activate the community to save some lives then. There's also an educational component to all this. You know, we're now just seeing some interest in this, and that's great. I don't think people know that in Southern California, we get winter heat waves. So I'm going to bring that up because I promised I would. I remember when I first moved here 25 years ago, and it was Christmas time, and it was 90 degrees, and I had the top down. I was driving around, calling my friends back in New York City, saying, you know, ha, 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 look at what I'm doing. You know, it was one of those Santa Ana days. Well, it turns out I should not have been laughing, because all those Santa Ana days, we've actually done research. These are winter heat waves. And even if the temperature is only getting to 90, not quite as bad as it does during the summer on a heat wave, relative to what people are used to, it's a huge jump. You know, you're used to 65 and 70 if you live in downtown LA in the winter, and suddenly it's 90, and you're not prepared for that. And it's that lack of acclimatization that occurs. And we see actually a 50% increase in deaths among the elderly during these winter heat waves. We've done that research. So I don't think anyone's really talking in Southern California about winter heat waves. I know that the newscasters, the meteorologists aren't warning us during winter heat waves. No one is really taking this seriously. And so I think one issue is another issue is education here.
That's so interesting. You know, that makes a lot of sense, because I lived in LA for 14 years, and yeah, that was the same conversation I'd have, you know, especially like at the Rose Bowl, right? You're going to the Rose Bowl when it's 90 degrees, and, you know, all these floats are filled with roses. And that was the whole point of that parade, right? Was to brag to everybody back east. And And it's just really mind-boggling to hear about the studies that show that there actually are deaths that occur during those times when you kind of, that's a bragging kind of moment. And the other thing too, I'm just thinking, you know, it's kind of still, you know, between that and then even the lack of data and the connection, you know, I just kind of keep thinking about other types of disasters in comparison to these heat waves, because a heat wave, right? What do we even call these type of disasters, right? They're just heat wave events. They're just record-breaking weeks, right? Like, what do we call the heat dome in Portland, right? When they went from, talk about climatization, right? Like Portland's used to getting what, 90-degree heat, and they got 116 over those 3 days in June. And, you know, just thinking about how if it was a hurricane that killed that many people, right, we would think that was the worst hurricane in existence, you know, and yet this is all happening and people really aren't paying attention. I mean, what has to be done? Like, what is the kind of thinking behind that, and how does data play a role, and how do we get that data in front of, yeah.
Well, let me just address that, because I show a slide in my lectures it's a picture of a street, and it says before the disaster, and then it shows the same street, exactly the same, and it says after the disaster, and it says, and I ask my students, which disaster is this? And they don't know, and it's a heat wave. And I also then make the point that the media doesn't cover it because it doesn't make for good pictures. There's no buildings blown off their foundations. There's no flames going up, you know, so it doesn't really make much media attention. So even though, as you said, David, yourself, heat waves cause more deaths on average each year than all other weather events combined, including hurricanes and tornado, they still don't get the respect they deserve from the media. And so as people haven't really learned to worry about them, and our systems have not in response, because the citizenry don't worry and the media doesn't make a big difference, our politicians aren't then getting activated about this.
So I think this is a great segue, or okay, really quick, Enrique, go ahead.
No, yeah, I was just going to say all great points by Dr. Eisenmann. And it reminded me of one of the conversations we had with the Office of Emergency Services, a state agency, where we were talking about the need to maybe name heat waves like they do with hurricanes as a way to maintain attention on these kinds of, you know, impacts that we've been conditioned to think as very kind of Southern California specific.
Yeah, no, that's definitely something that definitely should be considered. And Flora, just before we segue into the next segment, did you have one more thing to add to this topic?
Actually, I did. I was wondering why the I cannot say the word, Meteorological Society hasn't jumped on this, because like yourself, Dr. Eisenmann, I never heard the phrase winter heat wave when I moved to California 22 years ago from the East Coast. I too, with the top down, said ha ha to my friends, I will not say that again.
Yeah, I mean, I think it's taken some good research that I actually did with, I mean, it was really led by a famous meteorologist named Larry Kalkstein. And we found it by surprise. We were looking for what are the effects of extreme heat in Los Angeles. And we found by surprise that there was this effect in the winter when you got these really abnormally bad hot weather conditions that correspond to our Santa Anas. But when you know heat, you know that it makes sense, because again, when we get acclimatized, look, during the summer and fall months, more deaths occur from heat early on than later on, because our bodies acclimatize every summer. We get a little more used to it, so that by the end of the summer, early fall, this doesn't cause as much damage. It's actually the early season heat waves that are bad. This is the same thing. An out of the blue heat wave where people aren't prepared and the bodies aren't prepared, that's where it causes damage.
I would also suspect that maybe people at the, I'm just going to call it the MS, you know, society, the Meteorological Society, are probably yelling at the top of their lungs that this indeed is an issue. But unless the local media thinks it's a hot issue. And unless the National Weather Service is telling them that this is in fact an issue, then their message isn't going to get across to the populace.
No, thank you so much for that. This is definitely interesting on so many different levels. And I think this is a great segue really to Flora's next question, but just to set that up, the thing that really is striking to me and really breaks my heart is that there is an impact, and it's disproportionately older adults and disproportionately communities of color, as I think Flora is going to ask in this next question. But I mean, at the end of the day, right, like, yes, we're not talking about the impact, because I love that Dr. Eisenmann, the image of the before and after of the street. What disaster is that? There's no buildings blown up, there's no flooding, right? But there is an impact, and it's lives lost, and those lives are older and in disadvantaged communities. So Flora, I just wanted to turn over to you for that question.
Yeah, and before I do the question, that again speaks to the issue of, if we don't have the data to be able to put in front of people, we're not going to get anywhere. So I support that considerably. So California, God love it, is an exceptionally diverse state. And clearly there are inequities at stake here. For example, most of the heat records set in California this summer came from inland areas. 124 in Palm Springs was not fun. In fact, there were several typically high-income coastal areas that had mild summers in comparison. Can either of you or both of you talk through the inequities that are at stake here, regionally, demographically, and even in the communities economically impacted areas?
Sure, Flora. So as you know, California is a huge state, and it has a varied landscape, and that's what makes it so appealing. But at the same time, that presents some real challenges to our communities, and that communities just exist in a different shape, form, and landscape. So when we're talking about rural communities, for example, isolation becomes an issue. When they're isolated, then that means that they're probably isolated from jobs. That means that they probably don't have the economic means to adapt to extreme heat. And it also usually means that as a result, their health isn't doing very well. They have pre-existing health issues that, as Dr. Eisenmann has already mentioned, are made worse by extreme heat. And so you also see that in cities where historical disinvestment has created neighborhoods with absolutely no trees and no shade. People who live there because they have no choice. They usually don't have the economic means to prepare, adapt, or bounce back from an extreme heat event. And yet again, these are communities that have been severely impacted by poor health as a result. So, vulnerability to the health consequences of climate events is heightened when people experience economic, political, and social inequities. We've established that. People with limited economic resources living in areas with deteriorating infrastructure are more likely to experience disproportionate impacts and are less able to recover following extreme heat events, increasing their vulnerability to heat-related effects. And so again, this is something we see across California, and that was one of the reasons why our bill, AB 585, wasn't involved so much with promoting air conditioning per se, because of the extra burden that we're putting not only on people's pocketbook, but on the electrical grid. Because we know that when the power goes out, it's these poor marginalized neighborhoods that are experiencing those power outages. So we were trying to avoid that. And instead, we were looking to community cooling strategies, like I've mentioned already, to offset some of these high temperatures, so that if people indeed had to use an AC in their homes, maybe they weren't using them for 10 hours a day. Maybe they cut that in half. So that was the thinking behind bringing in and targeting funds to the communities that need it the most.
Dr. Einesman, anything to add that you've seen in terms of, or that you've shared with your colleagues in terms of the inequities across the state?
Yeah, so we've done a lot of research in this area. We several years ago did a study for Los Angeles County Department of Public Health, and we found that on a extreme heat day that occurred during the summer, there was across the board an average 8% increase in deaths on those days. So what does that mean? If on an average day, say 70 people in Los Angeles die, that on a heat day, another 6 or so would die on that day. But that number doubled from 8% increase to over 16% among older Black residents of Los Angeles and 14% among older Latino residents. So, to giving some numbers to what Enrique just said, double the risk of mortality on those extreme heat days faced by older Black residents and older Latino residents of Los Angeles. Again, tying back to lots of things, baseline health, baseline inequities in access to care, baseline inequities in the quality of housing, in access to any kind of cooled space, absence of tree covers over your home so that your home is, my colleagues have done, put temperatures inside, thermometers inside people's homes, out in Pacoima, for instance, on an extremely hot day. And, the house had no air conditioning, and the living room was 120 degrees. There was one air conditioner in a bedroom off of that was supposed to cool the whole house down. So, that's a death trap. We've also seen that there's clearly differences within areas as a result of this. So when we map it, we find that in Los Angeles, the communities in South LA, and then East LA, and then the northern high desert areas are the most affected. We see much more excess ER visits, hospitalizations, and deaths to all causes, not just heat illness. Because as Enrique said, heat illness is not well captured in the data any longer. So we just look for any excess bad outcomes. And we see bad outcomes across the board: kidney, lung, heart, ER visits, hospitalizations, and death in those areas of Los Angeles County. And then when we look across the state, we see particularly bad effects in the Central Valley, and we see particularly bad effects in the sort of northern rural communities of California. So Central Valley, of course, gets very, very hot. It's also disproportionately lower income, low wage workers, inadequate housing. And again, that sort of hits the point that David made earlier about outdoor workers. You've seen a lot of that effect there. Northern California, rural communities have poor access to healthcare. I mean, we talk about this urban heat island, but we shouldn't forget about other types of communities, especially in California. And so northern rural communities really face it disproportionately per capita, frankly, compared to other communities in the state.
Yeah, and I really appreciate you mentioning that because there's been a couple comments in the chat here that have referenced that, and really just to tie in those comments with what you were saying, right, and how this is a statewide issue, and how even going back to your climatization, right, like I was reading about how there have been more severe temperatures in foothill and mountain regions that typically in the summer, I mean, well, I'm not sure if everyone on the call, but of course, Lake Tahoe and the Sierras are a common retreat in the summertime, because typically on average over the last decade, those are cooler areas in the summer, but not so this year. And then you have added the twin problem of wildfires, right? And the smoke and the air quality adding to that increased heat that we're seeing in mountainous regions that aren't used to it. And you really have that double health whammy to people who are predisposed to heart or lung or kidney conditions. And even just thinking too, I was reading one study how, and AARP's worked a lot in this. I work on this issue of power shutoffs, right? PG&E serves 6 million customers in Northern California, and most of them or a large number of them are rural. And when you have the power shutoffs, those all occur in rural areas because those are the rural areas that have all the power lines that are causing, the wildfires, right? So just all very interesting things here. And just to kind of actually bring in that question from the comment right now, since we are running, it's amazing. We're running short on time already. There's been so much great discussion here, but someone did ask, what can you do? Any thoughts on that combination of the heat wave coupled with power outages? Like what do you do to prepare for that as a homeowner or a renter or just somebody in those service areas that could get cut off? What are those precautions to take?
Yeah, well, it's a really a dangerous situation. You're going to have no air conditioning at that point, right? And no access to a fan either. You're going to, it depends on your means. Of course, if you can get away to somewhere where you have access to power, you should possibly. If you are stuck at home, use water to cool yourself down. First of all, stay hydrated that way. I mean, just drink more than you expect to. Remember what I said earlier. You just should be drinking regularly. Like you always go to a nursing home, you see there's a cup on somebody's table all the time. You should have a cup of water on your table all the time and just keep constantly sipping, even if you're not thirsty. Put a cool, wet towel on your head. A lot of your heat is escaping through your scalp. So putting it on your head or around your neck, very important. Constantly wetting that and putting that on you is really important. If you can get outside and it's cooler under some trees in the wind, then do that. Go out with a wet cloth and some breeze, and that really helps things evaporate. Cool down at night. If you can even get some cooling down at night, that really makes a real difference, even a few hours. If you can get somewhere to these cooling centers are very important to use. I didn't mention having a generator. That's probably one of the things that homeowners who can afford it should have. But if not, try to get to places that have some power take it seriously. I think we need to raise our level of anxiety about these events and not just say, okay, I'll make it through. It's just hot. This is like a hurricane. This is our hurricane. We need to go where it's safe, go to a senior center and get a few hours of cooling. Even if it's not the most pleasant senior center in the world, just go for a few hours and cool down.
Well, I just want to make sure that since we only have about 6 minutes left to end on a positive note. So obviously this has been a lot of really useful information, but it's a bit of a downer, right? And thankfully we're, hopefully heading into cooler weather. I think today's the equinox or, can't remember what the actual day is, right? To go into fall, officially fall. But Enrique, we'll start with you. Because we did, when we were talking and preparing for this event, that you and Climate Resolve had some very good news to share as relating to the project that you were speaking about at the beginning of the call of what you wanted to do community cooling center wise. So could you talk a little bit about that? And then Dr. Eisenmann, could you share maybe a little bit about your research and what you're hopeful for over in the short term in dealing with extreme heat?
Absolutely, David. Thank you for that. Just to kind of start off on a downer to keep, emphasizing the idea that, climate change is here, extreme heat is here, it's getting worse. I wish we had, a superhero like Superman who could fly around the globe and spin it backwards and, take us back in time to when, our weather and our environment was a little better, but we don't. But I am happy to report that Climate Resolve, as well as many, many other partners, including the AARP, we were very successful this legislative session in getting a lot of our budget asks from the state budget And most of this is going to go to cooling our communities, like I mentioned earlier. And it's also going to establish resilient centers, which are absolutely critical. But on top of that, we were able to get a whole lot of money to increase the kind of reporting and the kind of studies that we do on the vulnerability of our state to extreme heat. So in total, we were able to get somewhere in the neighborhood of $550 million to do those kinds of strategies, pursue those kinds of scientific-based reports, and to pursue resilient centers. So that's absolutely great news for the state of California, because this is going to be spread out all over the state. We fought hard to move the legislature away from simply focusing on our coastal communities, which is what they really wanted to do. Climate Resolve was able to form a very, very large coalition of partners, from environmental justice to public health to the AARP, for example. And we were able to change the course of those funds. So that was our equitable win, and we couldn't have done it without the likes of AARP. So thank you very much.
Of course, happy to help. Dr. Eisenmann, any superheroes that you can share with us today?
Yeah, well,
besides yourself.
Yeah, I think, we're trying to engage more people. I'm going around teaching doctors and healthcare workers about this so that they are more attuned to it. They need the education as much as everyone else does, frankly. It wasn't something that came up in medical school too much. So sensitizing more parts of the community to the problem is really important.
Okay, so Flora, do you have any final thoughts? And I'm so sorry, we just had such a great conversation. I did see some questions that were answered in the course of our conversation there, and I brought up that one. But if you had any follow-up questions for our panelists today, please feel free to email me at the email that's in the chat. But Flora, do you want to end us off on your final thoughts and how on extreme heat?
Thank you, David. First of all, I want to thank Dr. Einesman and Enrique. Bringing this awareness, especially to those of us in California who are older adults, is really important. The individuals who have participated today and listening to what you have to say are going to go out and carry your message through, and continuing to do meetings like this, whether we post it on YouTube or on Twitter or on Facebook, and continue to get the word out. One by one, the domino effect can cause a change, and cause a change in a good way, so that the downer becomes an awareness, not a fait accompli. Thank you very much for letting me participate.
We couldn't have done it without Flora. Flora is one of our volunteer extraordinaires, and as always too, if you're interested in helping us and helping Flora get the word out on extreme heat, please feel free to email me. I dropped that into the chat there that you could see there. And we're more than happy to connect you with volunteer opportunities with the AARP. We're always looking for great volunteers. And yes, as Flora mentioned, we will be posting this video on our YouTube page in the coming days. But I just wanted to thank everyone for joining, and a special thanks to Dr. Eisenmann, who is doing so much for our communities in health and wellness. Thank you so much for spending this precious hour of your time with us. And Enrique, congratulations on the amazing work that you and the Climate Resolve team have been doing this legislative session. I know that we will get more wins next year, especially as we keep up the drumbeat of educating members about how important extreme heat is on our communities and how we can prepare for it. So again, thanks everybody for joining. I hope you all have a wonderful rest of your day, and stay hydrated and stay cool. Take care, everybody.
Thank you. Bye-bye.